Hello, I'm Alex Metricardi, Chief Marketing and Public Relations Officer for Living Branches, and today is Friday, August 28th. I'm here today with Edward Brubaker, Living Branches President and CEO, for another one of our weekly chats. Let me start with a review of where we are with coronavirus at our campuses. And I'm very pleased to say that technically speaking, we have 0 cases of coronavirus anywhere at Living Branches. And the reason that I say technically speaking is that we do have one staff person whose entire family has coronavirus, but they knew they were exposed. And so they have been self-quarantining, so there is no possibility that anyone at Living Branches was exposed. So we do not have to count that as a coronavirus incident for us. But Ed, maybe you want to talk a little bit about what we know about this particular case.
Yeah, and we certainly don't want to go into details about it as far as who it was and that kind of thing. However, it is... It's a sad situation. It's a great case study, but a sad situation because it shows how this disease is still out there, number one, and how it can be devastating if you are in situations where you are exposed. And it also reaffirms the idea of the 14-day quarantine when you are exposed, because it was into that 14-day quarantine when the symptoms started. And so if that person would have been back to work during that time, that would have been a problem. And so I know we're getting more and more pushback about restrictions and can't we do this, can't we do that? And I understand that. We need to also balance that with the health needs of the community, meaning Living Branches community, the population we serve, the reality that we don't want to resurge. And I understand Europe is maybe having some resurgence. We do not want that. So we need to be diligent. But again, for us, it was kind of a sobering reminder, frankly, that this disease is still around and it's still very serious, even though we feel that we're at a much different place. And frankly, we are at a different place than we were just a month or two ago.
Yeah. Well, and I mean, this person's family is sick.
Yes, this is not a walk in the park. This is serious.
There are hospitalizations
That's
involved.
Exactly right.
And so I think prayers would probably be appreciated.
Yeah. Very much so.
Yeah. You got to experience a little bit of a coronavirus-related situation impacting some plans in your household. Would you maybe want to talk a little bit about that?
Wasn't quite sure where we were going at the moment, but now I understand. Yeah, and it was really just an illustration of, I guess we're all in this together. We're all experiencing the realities of COVID. Our daughter, Brandy, was planning and did get married this summer, and actually just last Saturday, but it was plan C of the wedding. The original wedding was supposed to take place at Terrain down in Glen Mills, and that very early on, I don't even know, maybe by March or April, we were already talking with her and her fiance, now our son-in-law, but talking with them about that's not going to happen. And so plan B was to go to do the wedding in Missouri, St. Louis, Missouri, which is where her husband is from. And but we also knew when we were talking about that could change too if Missouri was put on the quarantine list by Pennsylvania. And Missouri is where his grandparents were a big influence in his life, and so they could have been at the wedding, and it was even there probably going to be less than 10 people, but Missouri was added. So probably 2 weeks after that we had looked at Missouri, it's now on the quarantine list. So that was plan B. So plan C was mom and dad, Lucy, in our side yard. And it turned out to be a very wonderful day. he was able to have his mother and two siblings come in, and his grandparents could be there via Zoom. But there was a grand total of 7 persons at this ceremony that was supposed to be for over 100. I don't say that to ask for pity, because it ended up being a very nice day. But I just say that to say we are all being impacted by this, some in bigger ways than others, and I don't want to make that more than what it was, because other people are staying in their apartments for months on end and things like that. So there are degrees that we're all dealing with this, but we are all dealing with it in some way, shape, or form. Life in 2020, not just because of coronavirus or COVID, for a lot of other reasons as well, some of which we've talked on these videos, but 2020 has been an unusual year, one that I can honestly say I've never experienced one like this in my lifetime, and frankly hope never again to need to experience one like this. But we are truly in this together. We need to be supportive of each other. We need to be resilient. And frankly, that whole experience with the wedding taught resilience. It taught the changing of decisions, the reality that you don't have to have this big wedding, number one, to get married, but also to have a nice event. And there was something nice about a small event too. So we need to look for those things we can be grateful for in life, because there's a lot of things here in 2020 that we would like to be done with. So anyway, just a story from my own life, but everyone, frankly, in this room and everyone in Living Branches would have a story to tell as well.
I noticed that this week I've gotten a lot of questions from various family members and residents, and a lot of those have been centered around visitation, and we see more events starting to take place, and how can I go to that safely, or what are my options? People wanting advice about that. So yeah, you can see life is trying to resume, and people are getting creative about how that can take place, but there's still a lot of dodging and weaving that's going on.
Yeah, that's right. And I just had some experiences this week with phone calls that came in that I needed to pass on to people, or things that I dealt with myself from families concerned about this, and family members who wanted to participate in an event off campus or whatever. And depending on the level of care, there's still restrictions. And there were legitimate questions asked about, okay, we have phase 1, phase 2, and phase 3. Where's phase 4, 5, and 6? Well, we haven't been given that yet. And so there is this void that is frustrating. It's frustrating for us as well. And we are committed to continue to work through this. But that is the reality of life right now. There's a lot of uncertainty. There's decisions that are being made that we try to make the best decisions we can. But I will say there's been mistakes that we've made as well, and we try to learn from them. So it is a very challenging time. And I would say overall people have been very supportive, very appreciative. And I appreciate the questions too, because we need to challenge ourselves and each other to say, is this the best we can do? Are there other things we can look at? But it is a challenge, and there are no easy answers, but we're committed to keep working through it.
And some of the stuff about the visiting requirements or guidelines doesn't impact people in residential living as much as it does people who are in personal care, memory care, or health care. But yes, as you say, we still do not have permission from the state to really let family members take those residents out off campus, even for simple things like getting a haircut or going to a birthday party, which is causing a lot of consternation for people.
Yeah, that's right. But when you think about it too, in personal care and healthcare, there's a lot more things happening in a congregate sense, if you will. If you're in residential living, you can go back to your unit, pretty much self-isolate if you choose to do that. And then other more group activities, there's some controls around that. Whereas in personal care and healthcare, there's dining that's now happening, appropriately spaced, et cetera, but there's just a lot more potential for transmission. And so I totally get and empathize with the sadness that comes along with not being able to do more. On the other hand, there's that risk, and continuing to balance that is really, frankly, the challenge. Balancing the risk of transmission and the safety with the other realities, too, of which the emotional health and well-being of ourselves as human beings is important as well. So it's a challenge, but like I said, we have a good group working at it, and we are committed to continue to work at this, to find ways forward.
And this last couple of weeks, we've seen perhaps a little bit of movement around this question of serial testing, which might have implications for visitation.
Yeah, that's right. And I have asked some persons to be working on this, and we've been working on it. We're not there yet, but we hope to be rolling out something in October. But honestly, there's new articles every day about new tests that are coming out, the efficacy and accuracy of the tests. So there's a lot of things to consider, but I really do believe that testing and trying to get a test, even if it's not 100% accurate, if it's accurate enough that we can screen out people in a quick fashion to say they're positive or to say they're negative, that will just be so helpful. And so we want to keep working at that. And honestly, I believe that that's probably going to end up having more of an impact on us in the nearer term than a vaccine will. Because again, I think we've talked about this sometimes too, a vaccine, even if it's ready by first quarter next year, and I know some people would like it to be earlier, and I would too, but we need to be realistic. But even then, it takes time to vaccinate people. Do people trust the vaccine? There's so many things. It's not a panacea. It's not a magic bullet. And so I think we have to have these other things like testing. And so honestly, it was a disappointment to me the other day when the CDC said, reduce testing. You don't have to test for symptoms. I will go on record saying I think that is a wrong move. I think that was a bad decision, and I think it was influenced too much by politics and not enough by medicine. I'll go on record to say that. Having said that, we're not going to pay attention to that because our state and our local government is stricter than that, and I believe, and I have believed since the beginning of this pandemic, that testing is such a critical way for us to get to the other side. And so we're absolutely pursuing that. We're not there close enough to announce anything yet, but we're definitely working on finding ways to use the quick antigen tests that we can get a good read on things. And that will be coming, I would say, over the next few months.
I was disappointed with that CDC announcement. I think in part because for me, it seemed like there's been a lot of changing guidance that's come as a result of this pandemic. And for me, we're learning every day. And so that in some ways is understandable to me. This decision was the first time it really felt overtly political to me. And I think part of the reason I was so disappointed in that is that, from my opinion, what we've learned in the testing that we've been able to do recently versus the testing that we could do back in March and April, to me, that really did demonstrate the very concrete positive benefits of being able to test our residents and our staff persons as soon as we suspect that somebody might have it. From my opinion, that really reduced the spread at Willows and in Parkview.
That's right. And that's the important thing to keep in mind, too, is that negative tests are great because the challenge of not if they're false negatives, but you're really trying to find out who's positive so you can get them isolated as soon as possible. So the actionable data is really the positive test. And so when you have that, you can say to the staff person, you need to go home immediately and get a PCR test if it was an antigen test that we ruled.
That's the one up the nose, right? That PCR.
The PCR. It's a more accurate test, but the antigen test can give us a good read quickly. So that's really to do that, so you can isolate and take action. And and avoid the risk of spread. That's really, I think, key and critical. So I'm hopeful that this will give us some better answers going forward, because I know families are frustrated, staff is frustrated, residents are frustrated with how do we keep moving toward more of a sense of normalcy, and it's a challenge, but we are committed to keep working at it and find ways that we can do it. Frankly, even if it costs us money, because we feel it's an investment in our health and safety, but also to make us an attractive place for people to move into as well, because we are a vibrant community, and we will be even more vibrant, in those probably, hopefully less than months, too many months, but it's going to be quite some period of time. But we need to find ways that we can do that in a safe and good way.
It was nice last week to recapture a little bit of that vibrancy. It was our chicken barbecue week. And so we had at Dock Woods, I know they had an ice cream truck, and they had an in-person concert out in the parking lot at Souderton, because they have the in-house television channels. They had some nice programming with that. And then, of course, we had the auction, the hymn sing, the concert. And from what I heard, we ended up raising over $18,000 towards the Benevolent Care Fund out of all of those sources.
Very good.
So it was nice to see.
Yeah, it was very nice. And I got quite a few notes, actually, from residents just expressing their appreciation and gratitude. And for me, it was nice, obviously, to get the notes. I mean, I don't expect to get those things. That was certainly nice and thoughtful of people. But for me, the thing that hit me was, we've had a challenging couple of months, and here are these people that are finding ways to be grateful. And I just think that's an important lesson for me, too, to say, when I get down or depressed or concerned or down in the mouth, just to remember, what are those things that I can still be grateful for? Because there are still those things out there. And honestly, I think that's a secret to a long and happy life, and frankly, one that I need to keep learning, to be honest. But that idea of gratefulness, that was so impressive to me. Just the sense of gratefulness that came through those persons' notes and other comments they would make, that focusing on the positive, which is wonderful.
Yeah. Well, thank you. Any closing comments that you'd like to make?
Probably just to say, hang in there. We will get to the other side, but it is a bumpy journey. We will have fits and starts. We will have frustrations. Continue to grant us patience. Be patient with us. We will keep working hard on your behalf, on behalf of staff and residents and families. But it will be bumpy, I can guarantee. But we will be committed to keep working at finding ways that we can make life as enjoyable as possible, and really keep working toward getting back to that sense of calm and good experiences for all of us. So again, hang in there, and we'll get there, and we'll get there together.
And as always, if you have questions, feel free to send them to coronavirusquestions@livingbranches.org. And of course, you can always check our website. That is where we have the most up-to-date information about what step we're on with coronavirus, what's open, what's closed, how to sign up for visitation. All of that is at livingbranches.org. Thank you very much, and we'll talk to you next week.